A healthy body speaks to us in whispers. A subtle ache, a new sense of fatigue, or a change we can't quite put our finger on. One of the most frustrating of these whispers is persistent bad breath, especially when you feel like you're doing everything right. You brush, you floss, you visit your dentist, yet that lack of freshness lingers, quietly chipping away at your confidence. It can make you pull back just a little when you lean in to hug a grandchild, or second-guess speaking up in a social gathering. This isn't just about hygiene. It's about a loss of ease in the world, and it's a frustration that so many women carry in silence. But I'm here to tell you that this whisper is often not coming from your teeth at all, but from a deeper story your body is trying to tell. I'm Dr. Emily Hart, and for over 15 years, I've had the privilege of helping women navigate the changes in their bodies with clarity and compassion. This space is for us, to explore our health with dignity and find solutions that truly work. If that sounds like a journey you want to be a part of, I invite you to subscribe to the channel. And I truly love knowing where this community of strong women comes together. Tell me in the comments, where are you watching from today? It's a joy to see our community span the globe. Now let's talk about that frustrating issue. When meticulous dental care isn't solving the problem, it's time to look a little deeper. Today we're going to explore 3 common, yet often overlooked causes of halitosis in women over 60, and most importantly, what we can do about them. Our first area of focus is something I call the silent saboteur, dry mouth. This is far more than just feeling a bit thirsty. It's a persistent, uncomfortable dryness that can make swallowing difficult and conversations feel strained. You might find yourself constantly reaching for a glass of water, or waking up in the middle of the night with a throat that feels like sandpaper. The real-world struggle is in the self-consciousness it creates. I remember a patient of mine, a lovely woman named Carol. Carol was the heart and soul of her weekly book club. She was known for her insightful comments and her infectious laugh. But lately she had grown quiet. She'd sit at the edge of the group, a hand often hovering near her mouth. She confessed to me with tears in her eyes that she was so worried about her breath that she had started to dread the one social event she loved most. She was meticulously clean, but nothing seemed to help. When we looked at her health history, we found a clue. She had recently started a new medication for her blood pressure. Here's the simple science behind it. Think of your saliva as a gentle, constantly flowing river in your mouth. This river's job is to wash away tiny food particles and neutralize the acids produced by bacteria. It's your body's natural mouthwash. But many common medications for conditions like high blood pressure, depression, and even allergies can have a side effect of slowing down that river, or in some cases drying it up almost completely. When the riverbed is dry, that debris, the food particles and bacteria, get stuck. It's no longer being washed away, and as it breaks down, it releases sulfur compounds, which are the source of that unpleasant odor. The solution for Carol, and for many of you, can be gentle and natural. First, hydration becomes your best friend. This isn't about chugging water a few times a day, but about consistent, small sips of water all day long. Keep a beautiful water bottle with you as a constant companion. Second, you can stimulate your natural saliva flow by chewing sugar-free gum, especially one containing xylitol, which has been shown to inhibit bacterial growth. Sucking on sugar-free lozenges can also help. At night, using a humidifier in your bedroom can add moisture to the air and provide significant relief. For Carol, we also discussed her medication with her primary doctor, who was able to switch her to an alternative with fewer side effects. The tangible benefit wasn't just fresher breath. It was seeing Carol's light come back on. She started speaking up in her book club again, laughing freely, no longer hiding behind her hand. You have the power to rehydrate not just your mouth, but your social confidence as well. Now let's move on to our second potential cause, one that feels a little deeper. This is what I call the uphill battle: acid reflux, or GERD. For many women, this doesn't present as the classic fiery heartburn you see in commercials. Instead, it's more subtle. It might be a persistent sour or bitter taste in your mouth when you wake up, a chronic need to clear your throat, or a recurring sore throat with no other cold symptoms. And with it, a type of bad breath that seems to come from the very back of your throat, a scent that no amount of mouthwash can touch. I think of Margaret, a wonderful patient who was a passionate home cook. She told me her greatest joy was preparing beautiful meals for her husband, but recently she'd started to dread her own cooking. She'd eat a delicious dinner and then spend the night propped up on pillows, feeling an uncomfortable pressure in her chest and waking with a deeply unpleasant taste. The most heartbreaking part for her was noticing her husband gently turn his head away when she leaned in to kiss him good morning. She felt ashamed, as if it were a reflection of her own body failing her. The science here is all about a tiny muscular doorway. At the bottom of your esophagus, there's a valve called the lower esophageal sphincter. Its job is to act as a one-way door, letting food travel down into your stomach and then sealing shut to keep it there. As we age and due to hormonal shifts and lifestyle factors, this little door can sometimes weaken or relax when it shouldn't. This allows small amounts of stomach acid and even undigested food particles to travel back up into the esophagus, especially when we lie down. The gases and odors from your digestive system are literally finding an escape route through your mouth. The solution for Margaret was not about giving up her love of cooking, but about working in harmony with her body. We started by identifying her trigger foods. For many, these are spicy foods, caffeine, chocolate, or very fatty meals, especially when eaten late at night. The key was to enjoy these things earlier in the day and to have a lighter, simpler meal in the evening. We also made a simple mechanical change. She placed small blocks under the head of her bed frame to elevate it by about 6 inches. This uses gravity to help keep that little doorway closed at night. Finally, she discovered the soothing power of a cup of chamomile or ginger tea after her evening meal, which helped to calm her digestive system. The benefits were profound. Margaret started waking up refreshed, without that sour taste. She rediscovered the joy of her kitchen, cooking with mindfulness instead of fear. And the sweetest victory? The morning her husband held her face in his hands for their good morning kiss. This is about bringing gentle harmony back to your body's natural rhythm, and it is entirely within your reach. If any of this is resonating with you today, I just want you to take a gentle breath and know that you are not alone in this. These are common, shared experiences, and talking about them is the first step toward feeling better. Our third and final stop today is the hidden culprit, your sinuses. So often we think of sinus issues as just a stuffy nose or seasonal allergies, but they can be a major contributor to bad breath through something called post-nasal drip. This can feel like a constant tickle or lump in the back of your throat, making you want to clear it all the time. The struggle is that the source of the problem feels completely disconnected from your mouth, making it incredibly difficult to identify. Let me tell you about Susan, an avid gardener who found her greatest peace among her rose bushes. For years, her spring allergies meant a runny nose and itchy eyes, but lately she noticed something new. A persistent, musty odor on her breath that seemed to worsen with the pollen count. She felt deeply self-conscious when she would lean down to show one of her grandchildren a newly bloomed flower, worried about what they might notice. She was treating her allergies, but this other symptom just wouldn't go away. Here's what was happening inside her body. Your nasal passages and sinuses are lined with a membrane that produces mucus. This is a good thing. Mucus is designed to trap dust, pollen, and bacteria, protecting your lungs. Normally, this mucus is thin and flows harmlessly down the back of your throat, and you swallow it without ever noticing. But when you have allergies, a cold, or a sinus infection, your body produces much more mucus, and it becomes thicker. This thick mucus can't flow as easily, so it drips slowly, coating the back of your tongue and throat. This mucus is protein-rich, and it becomes a feast for the anaerobic bacteria that live in your mouth. As these bacteria break down the proteins in the mucus, They release those familiar, smelly sulfur compounds. The solution for Susan was about clearing the pathways. We introduced a simple daily saline nasal rinse. You can use a neti pot or a simple squeeze bottle. This practice gently flushes out the excess mucus and allergens from the nasal passages before they have a chance to become a problem. It's like giving your sinuses a refreshing, gentle shower. Staying very well hydrated is also crucial here, as it helps to keep the mucus thin and flowing properly. And just as with dry mouth, using a humidifier at night can make a world of difference, preventing your nasal passages from drying out. The benefit for Susan was like a breath of fresh air, in every sense of the word. Her throat felt clearer, she stopped that constant little cough, and the musty odor vanished. She could once again share the joy of her garden up close, with a full heart and complete confidence. By gently caring for these hidden passages, you can clear the way for better breath and a greater sense of well-being. So you see, your body is in constant conversation with you. That whisper of concern about your breath may not be a sign of failure in your dental routine, but an invitation to listen more closely to your digestion, your sinuses, or even the side effects of your medications. This is not another thing to be worried about. This is an opportunity to become a more compassionate detective for your own health. You have lived a life rich with experience, and you possess a deep, intuitive wisdom about your own body. Trust that wisdom. You are worthy of feeling vibrant, confident, and comfortable in your own skin at every single age. Your health is a journey of continuous learning and gentle adjustments, not a destination of perfection. I want to thank you for spending this time with me today. My hope is that you leave here feeling not just informed, but genuinely hopeful and empowered. To keep this conversation going, I invite you to share one small kind step you plan to take for your health this week in the comments below. It could be as simple as buying a new water bottle or trying a cup of ginger tea. Your journey can inspire someone else in this wonderful community. Until next time, be well and be incredibly kind to yourself.